Dear Larry, dear colleagues, dear friends, with enthusiasm, we are today introducing our new society, the International Society of Glomerular Disease. So Larry and Kathleen this morning highlighted our short history as podocyte researchers, reaching 25 years back. And they highlighted that the podocyte researchers catalyzed complex understanding of cell physiology, complex understanding of cell pathophysiology, advancing technologies, and probably also nucleating progress and advancement of nephrology in general. And actually, many members of us also became promoted into quite visible positions, and as we just heard in the last coffee break, Jochen Reiser has been today announced as president of the University of Texas, the UTMB branch. Congratulations, Jochen. Now, equally important has been the mindset. We started as complete outsiders. We were willing to take risks, we were willing to enter new lands, and we were willing to move innovation forward, and we realized that it is absolutely essential to us that we openly share our resources, that we collaborate, that we are bound to each other if we want to achieve something, and that the altruistic momentum was quite important when we all together started on this mission of podocyte research. Now these two things, our advancement in nephrological research, but also the mindset that kept driving us, is now the logical next step to our International Society of Glomerular Disease that we together are mothering at this podocyte meeting. Now let me quickly introduce a bit of what we envision. So basically we are being built on our advanced understanding of glomerular biology that we drove together over the last 25 to 30 years. We're also based on our advanced understanding of glomerular physiology, and we realize that the glomerulus is the arena of kidney diseases, particularly immune-mediated and genetic, rare as well as common diseases, also metabolic and hypertensive mediated disease. But we also realize that there is the need to advance further to the specialty of glomerular medicine. Further improve our understanding, come up with preventive strategies, with novel diagnosing and stratifying strategies, and also with more and new individualized treatments. And this is associated with major unmet needs. So with the increase of knowledge, it's becoming more and more difficult for general nephrologists to stay current with all the ongoing advance in knowledge. There are multiple new treatments on the horizon. Never have there been more trials in the glomerular field, and there is actually massive difficulties in the recruitment and the alignment of patients to these trials. Of course, there's been a referral hesitancy to the specialists. That's why it's important that we mark this specialist of glomerular medicine, and the better the access is to these specialists, the better the care will be for our patients. Now, on a more pragmatic perspective from our patient. So, a patient wants, in the best case, to have prevention, but at least early recognition of a glomerular disease. Then he wants to have access to a glomerular disease expert to get the precise diagnosis. And in the next step, the patient will expect state-of-the-art treatment and access to ongoing trials. And of course, as we heard this morning from the Lewandowski family, they also want to have access to improved and novel therapies for the many, many diseases where we still don't have answers in terms of new treatments. Finally, ending up with an individualized therapy and improved outcomes. this is exactly where the ISGD now places their pillar committees. So basically filling the gaps in between these steps. So improving the recognition, which is done by our membership and accreditation committee. Improving the education, setting up GD fellowship programs across the world by our education committee. Professionally supporting the setup of centers of glomerular excellence across the globe. And of course, improving the access to clinical trials, promoting centers of clinical trial, glomerular clinical trials of excellence, and also aligning patients, generating platforms where we can align patients to these individual trials, and of course also further advancing what we all did together, the basic and translational research. Now, a third of the people sitting here are part of our leadership panels already, so 100 members, and they are being led by chairs through our 5 pillar committees, and all also sitting here, and all of them are well known to you, and we thank really for the enthusiasm of all these members that helped really to push these initial steps forward. I think it's also important for us as a community and as podocyte and glomerular researchers, not just to understand glomerular disease, but also to move on to reclassify, to better stratify our diseases, including causal factors and molecular drivers that directly translate to a better alignment and assignment to the clinical trials, and to a promotion of new therapies, and finally to come to a better outcome. Now, perspectively, basically, we have been moving from podocyte research to understanding glomerular disease. We are now creating the field of glomerular medicine, and we move on to glomerular health. And once we reach glomerular health, we might rename our society to International Society of Glomerular Health. And the ISGD will be the central hub to gather information, to make access to the different steps for all stakeholders in the field. Now this shows the representation of the members of our pillar committees, and it has been really satisfying that when we reached out, all leaders immediately agreed to take part in this mission. And it's really across all the disciplines of nephrology, pediatric nephrology, nephrology, genetics, and so on and so forth, and pharmaceutical partners, patient partners from 6 continents, 22 countries, and these are just the members of our pillar committees. Now, of course, as you see, the Global South is not underrepresented, so that's why we will develop programs of partnering, forming tandems between the Global North and the Global South to support glomerular medicine across the world and also in underprivileged regions. Now, the membership benefits that the different committees have been setting up are, of course, being part of this community, having access to information, having access to our educational programs. We're just doing surveys of the programs being in place with glomerular fellowships, what we can learn from them, and we will then basically facilitate the clinical trials where we will map all the ongoing clinical trials, the centers where people can be recruited to make statement papers on where we see gaps in the basic and translational research field. Now today is our moment, and we turn it in a momentum, eventually a movement. For us as a podocyte community, we see it as the next logical step that we formalize our advance in such a society, that we drive it forward, that we bring more benefit to our patients and to our outcomes. And since we all love doing experiments, here's the experiment of the day. You see the barcode, the scan code, you take out your cell phones, and let's try that we increase our number of members within a minute, or double the number of our members within a minute. So take out your phones, do a scan. It's an inaugural member of our society, helping us to move glomerular medicine forward to glomerular disease, to glomerular health.